Society and the Indian Association for Sexology. Welcome to all of you. I would like to start every prayer with a Tamil Thai Valthu, none other than our motherland, Tamil Nadu. The Tamil Thai Valthu, please. Chitrakala?
Yes, ma'am. Can you please stop share, ma'am?
Yeah. Much. Now, I request all the dignitaries to join us in lighting of the lamp before we start any occasion in India. This is a traditional way, madam, of starting anything to have a good and to make it go smoothly. We light a lamp for the blessings of the divine. Thank you. Now I would like none other than our dearest darling Jairani madam to introduce our guest speakers and give us a welcome. Madam is a person who needs absolutely no introduction. So I'll make it short to say that she's a brain behind it. She lost the chairpersonship. She's always a winner in everybody's eyes. Madam, over to you without much delay.
Thank you, Krishna. Thank you, Krishna. Thank you for your words of introduction, and thank you so much. And it gives me great pleasure, honor, and pride to welcome all the dignitaries, the faculties, both national and international, to be here to celebrate the World Sexual Health Day celebrations on September 4th. And it gives me great pleasure and honor to welcome the chief guest, Dr. Elna, who is a very young and dynamic president of the World Association for Sexual Health. Thank you, Elna, for joining us in midst of your busy work schedule, working for World Sexual Health Day and working day and night for all the upcoming Congress. Thank you for joining us. We welcome you all on behalf of Indian Association of Sexology and my OXY, and also Indian Menopause Society, which is joining. And we have the great pleasure to welcome you. I have the great pleasure and honor to welcome our dignitaries, Dr. Kamraj, the president of the Indian Association of Sexology, and Dr. Revati Janagiram, madam, who is the president of the TNFOG, Tamil Nadu Federation of Obstetrics and Gynecologists, and Madam Dr. Jamuna, who is the secretary of the Telangana OBGYN Society Federation. And it gives me a great pleasure and honor to welcome the international faculty, Dr. Vijay Sardi, who has with the great consent to accept our invite within a short time. Thank you so much for joining us. And also my senior national faculty, Dr. Sanjay Pandey sir, and my lovely friend, Dr. Kiran, and Krishna. All of you, I extend my heartfelt welcome to you one and all to join in this international webinar on the celebration of World Sexual Health Day. And I thank you one and all with my hands folded. We welcome you all, the traditional way of Indian way of welcoming you all. We welcome you all for this webinar. So it's my great pleasure and honor to welcome and introduce our chief guest, who is a very dynamic young woman who is from a developing world, who has to occupy the greatest position in the World Association for Sexual Health by her dynamicity, by her visibility, and by her energetic work, what she's doing in the field of sexual medicine. Madam is the present president of the World Association of Sexual Health, the second woman to hold this post internationally, and the first woman from the South Africa, which is a very, very important work that we all admire and look upon, and very much inspirational. And she's well known for her dynamic work of a lot of work she's doing in South Africa, as well as in the International Forum of World Association of Sexual Health by her dynamic work. And she's actually a medical doctor and a sexologist from South Africa. And she is the first doctor in South Africa to obtain the higher diploma in sexual health and HIV medicine through her colleges in medicine in South Africa, and obtained the master's degree in sexual health from the University of Sydney, Australia. And she became one of the first fellows of the European Committee for Sexual Medicine, the highest attainable internationally recognized qualification in sexual medicine. And she is the executive board of member and director of the South African Sexual Association, SASHA. And she has done a very great work in the sexual medicine, especially in the last Congress in South Africa, in the Cape Town. And she has done a wonderful, amazing work in the sexual medicine. Over to you, Elna, to deliver your presidential address of this webinar.
Thank you very much, Sharani. Ladies and gentlemen, distinguished guests, esteemed colleagues and friends from around the world. As the president of the World Association for Sexual Health, a very warm and gracious welcome to each and every one of you as we gather here today on this momentous occasion on the day before World Sexual Health Day on the 4th of September. It is with immense pleasure and honor that I stand before you as we embark on this enlightening journey in the realm of sexual health and consent, with so many distinguished guests from India and globally as well. Before we delve into the heart of the discussion, I would like to extend my heartfelt gratitude to you, Dr. Jirani Kamaraj, and the Obstetrics and Gynecology Society of Southern India for taking the initiative to host this international webinar. Jirani is on the executive committee of the World Association for Sexual Health, and we value you, Jirani. It's such a pleasure to have a powerful woman from India there representing your country and your continent on a global stage. Thank you very much. Jirani, your commitment to advancing knowledge and fostering dialogue in the field of sexual health, particularly in India, is truly commendable. As we gather here under the banner of consent, it is essential to recognize that consent is not merely a legal or a medical concept. It is a fundamental human right. It is the cornerstone upon which healthy relationships, trust, and respect are built in intimate relationships as well as in our relationships with our patients. These issues surrounding consent are complex, evolving, and often culturally sensitive. It is our duty as medical professionals, researchers, and advocates to unravel these complexities and to shed light on the path to informed, enthusiastic, and affirmative consent. Through this international webinar, we aim to foster an inclusive and collaborative environment where experts can share their insights, experiences, and best practices. For WAS, we are always embarking on a consultative process where we absolutely value the regional input. There's no way a global organization can be truly regionally and locally representative. So it's in the hands of local organizations to bring the local perspective, and as WAS, we truly value this. I encourage each one of you to actively participate in the discussion, ask questions, and engage in dialogue. By doing so, we can collectively contribute to the advancement of knowledge and the promotion of sexual health and consent on a global scale. Together, we will strive to promote sexual health and cultivate a deeper understanding of consent, dismantling misconceptions and myths along the way. In closing, I extend my deepest gratitude to the organizers and to each one of you who are attending and gracing us with their presence and expertise. I also want to thank all of the speakers and panelists and attendees for their dedication to this vital cause. Let us embark on this journey. I thank you.
Thank you, Elena, for the nice words of wisdom. Thank you. And it is really, thank you for being with us to bless us for this webinar. And thank you so much. And we have the guest of honor, Dr. Revati Madam here. Madam is the president of the TNFOG, that is the Tamil Nadu Federation of Obstetric and Gynecologists. And Madam is the professor and emeritus of the MGR Medical University and the past vice president of FOXI 2016. And she's been a mentor and teacher for many postgraduates and many students. And she has been a winner of the various awards and conducted very many international and national conferences. And she's the founder secretary of the Madurai OBGYN Society and the past president of MOX Madurai. And she has done a lot of, academic work as an academician and trained most of the postgraduates and UGs from Madurai. And we're all very happy to say that I'm the student of Madam and she's the mentor of mine. And Madam, over to you to bless us with your words of wisdom.
Thank you, Dr. Jayarani, for your kind words. Good evening, all. And thank you, and I welcome Dr. Elena. Good evening, Dr. Elena, for coming here. And regarding the sexual health aspect, which is never explored, this is being brought into light by various FOXI webinars of late. And I know Dr. Jayarani is doing a lot of work on that, though she missed by a few words this time. She is still continuing to do work on this as secretary, committee chairperson of sexual health in TNFOG. And she does a lot of work, and her work on this area is quite commendable. And I wish you success in the next FOXI election, Jayarani. And the topics chosen here are very, very important. Consent, especially consent for normal marital sexual life is also very important, especially the topic on marital rape. This reminds me of an incident of my neighbor. Actually, that girl, I only delivered her 25 years ago. And this girl got married and gone to Bangalore. And she had this problem of marital rape. She doesn't know how to handle it. When she told her parents, as usual, they said that don't worry, just it will become automatically normal. Just like that, they counseled her, they didn't guide her properly. Ultimately, it ended up in suicide. So that was really a very, very pitiable thing that many girls, even educated girls, are not aware of what is to be done, what is their stand and all those things. So also the parents, and so also the many of doctors. So this is an area where such webinars will definitely enlighten not only the doctors, but also their patients to handle such situations. And I'm sure all these topics will benefit all the delegates. And I wish this webinar a grand success. And I wish Jayarani also success in all her future endeavors. Thank you very much.
Thank you so much, Madam. I would like to, now it is a pleasure for me to invite the next guest of honor, none other than Jayarani Madam's, I think, Jamuna Devi Madam. Madam is a medical legal advisor and has held, she's the president of the society, Hyderabad Society, a treasurer for Telangana State Society currently, and she's a secretary of the Menopausal Society of Hyderabad. Madam, over to you for a few words.
Thank you, Krishna. And first of all, thank you, Jayarani, for inviting us for this wonderful journey. Actually, I should say, I think we all are putting our efforts. And I must appreciate Dr. Elena and Dr. Vijay Ramanathan for staying so late. I understand that in Australia, it is very late night. Thank you for being with us. And I think we all have to put our effort to bring this sexual health awareness among our youngsters. Because all the doctors, we all know about these things. But I think now it's time for us to go into the society and encourage to teach about these sexual health. Even today, I think most of us shy away talking about sex in front of, our own patients, especially when husband is around or mother-in-law is around. I think we also have to come out of it. And I think Jairani, she is doing a wonderful work. I think me and Kiran are also organizing the sexual health awareness programs in a college and nursing college, and we are going to have a walk also in these 3 days. Hopefully, we'll bring about some change in some percentage of girls and boys, men and women. Thank you for this. I think it will be a wonderful webinar. Thank you so much and wish you all good luck. And I think I would also like to become a member of this World Sexual Health Association. I have written to them. Thank you so much. I think this was motivation from you, Jairan.
Thank you so much,
Thank you,
madam.
madam. Thank you for your kind words, and thank you so much for joining us in midst of your busy work. And thank you for blessing us and giving us all the inspiration. And I really so humbled with all your presence to support me, to give me the best encouragement that I can have. Thank you, ma'am. Thank you for joining us. Now we'll move on to the academic work. Dr. Kamraj is just held up in one important shoot. I think he'll be joining a little late. We'll go ahead with the academic work. Krishna, over to you to introduce the
Thank you,
chairperson.
madam. Thank you so much. It's an honor and it's an honor and a privilege to introduce our chairpersons, Hepzibah madam, who's been a past president of OGSSI. And also, I think whenever I think of madam, it is her ever-present beautiful rose and her beautiful smile that she always carries with her. She's been a inspiration to so many of us. And because we are running a little late, I will cut her this thing short, because I think one slide will not do her justice. Please, Hepzibah madam, please take over the chairperson. The chairpersonship of this session. The next slide, please. Chitrakala, yes. Shanti madam. Shanti madam is a person who is very dear to my heart. I think when I did my first conference, madam came and she did so many things for me. So madam is a very dear mentor and a very dear person. And she's been, she again has had a lot of this thing under this. So she's an apt person to chair this session. Please welcome Shanti madam. Please take over the chair. Next slide, please. Dhanalakshmi ma'am. She has been a wonderful person. Madam has been a UG and a PG teacher in 1995. And she's taught so many of us. And every time she chairs a session, we always learn something from her. Please. And over to the chairpersons to introduce our speakers. Vijay Sarathi, sir.
It's talking about sexual right, is it?
Yes, madam. Yes,
Can I
madam.
introduce him?
Yes, please do, madam.
Dr. Vijay Sarathi Ramanathan. He's a lecturer in sexual health, Westmed Clinical School. And he has a postgraduate qualification in sexual medicine from University of Sydney. He has done an undergraduate degree in medicine and surgery from India. That is very great. And it's a fellow with the European Society for Sexual Medicine and Higher Education Academy from UK. He has 15 years interdisciplinary clinical practice in sexual health across India and Australia. And since 2017, he has been working as a lecturer in sexual health, the Faculty of Medicine in both teaching and research capacity. For about 14 years, he has worked as a project officer in various primary healthcare initiatives funded by Australian Commonwealth Government. 2015 completed first of its kind doctoral research on sexuality of Indian migrant men living in Australia. have a passion for sexual health promotions by means of designing and delivering educational activities for multidisciplinary healthcare professionals. I think he is the right person to talk about sexual right because it is considered as a part of existing human rights and a fundamental freedom and fulfillment of sexual health. And it should be protected and fulfilled. The sexual right should be protected and fulfilled. And over to you, sir.
Thank you, Dr. Hefsi, and thank you all for having me, and thank you to Dr. Jayarani for inviting. So I am from Sydney, and I also doing this presentation as part of my role with Sydney University. Now a quick check, am I audible and visible? Are my slides
Yes, sir.
visible? Beautiful,
Yes.
thank you. And I would like to start by acknowledging the traditional custodians, the elders past, present and emerging, the lands on which the University of Sydney campuses stand. For thousands of years, they have shared and exchanged knowledges across innumerable generations for the benefit of all. And I also acknowledge the land where I was born and brought up, Tamil Nadu, India. And I also like to acknowledge the values of the two organizations that have put together this lecture series. That's about me. I'm not going to go in detail, which I've been well introduced. Now, this is an academic session and I've been given 20 odd minutes. So what I'm going to do, the overview is I have only one purpose for doing this lecture, and there is only one learning outcome for all those who are listening to this session. And I'm going to cover two topics. One is sexual rights and the other one is sexual consent. And then based on that, I'm going to apply that in three different scenarios, one to do with reproductive side, the other one is relationship, and the last one is pleasure. These are all real case scenarios that I have seen in the last many years. And finally, I'm going to talk about the 4 pillars, because sexuality and sexual health is not just about one-on-one consultation or a couple consultation. It's high time to consider it as a public health issue. It's no longer just a individual health, it's a public health, and we'll talk about the 4 pillars of addressing sexual well-being and health and justice and pleasure. And then I'll finish it off with 5 key messages. So the purpose of me doing this lecture, the topic was given to me, but I frame my own learning outcome. So at the end of the session, if participants able to appraise or evaluate the importance of sexual rights informed sexual and reproductive health care, then I think that's very meaningful. And sexual rights, if you literally read it, it might come across very dry and it's full of words. It's sort of lot of technical terms, but I'm not here to read out the different rights. I'm here to give my perspective as a professional, as an academic, and also help apply sexual rights in what we do as professionals, healthcare professionals, and how our day-to-day clinical practice could be well informed by sexual rights. So that's what I'm trying to achieve in the next 20 minutes. Now, I'm sure you can read this. This is nothing new, but let me start with a quick definition of what this sexual rights is all about. As it's already been mentioned a couple of times, sexual rights is part and parcel of human rights. So that's already made it very clear. But more importantly, sexual rights protects all people's rights to fulfill and express their sexuality and enjoy sexual health with due regard for the rights of others and within a framework of protection against discrimination. Now, that's sort of an operational definition of sexual rights, because it's extremely hard to have a definition and try, because the breadth and the depth of sexual rights is so enormous it's very hard to fit in a definition, but in my view, that sort of captures many aspects of sexual rights. Now there are about 16 different rights when it comes to sexual rights. So let's go through one at a time. I'm not going to spend a lot of time, but it's important to give a close attention to it. The first and foremost is equality. Okay, so that's cuts across all other rights when it comes to equality. It's not just one, it sort of covers and part and parcel of all other rights that we are going to talk. So equality and non-discrimination is very, very, very important. Then comes the liberty, okay? The right to live, the right to liberty and security is very important. And then the bodily integrity is also very important, okay? How a person to an autonomy and bodily integrity is the third right, okay? And the fourth one is the right to be free from any form of torture or coercion or even a degrading treatment. We might think, oh, where is this happening? But if you take a step back, there are a lot of treatment modalities being portrayed and popularized to change people's orientation. So those sort of things are definitely part of sexual rights, which needs to be condemned, and that needs to be upheld as part of the sexual rights. And then comes no to violence. So free from any form of violence is very important, and coercion. And then the privacy, the right to privacy is the next right. It's very important as well. And I have a reason why I have only boxed certain rights with a red border. I will come to that later. And then the next one is the right to achieve the highest attainable standards in sexual health. And when we talk about highest standards in sexual health, that also includes pleasurable, satisfying, and safe sexual experiences. So that's also part of a sexual right. And then also be able to access the advancements in science. Okay, so whatever the advancements, the benefits of scientific progress, which sort of it's related with sexual health, but then it's on its own. And then here comes the most important one, the right to information. Okay, so sometimes I see that when a person comes with no knowledge is sometimes a blessing, as opposed to someone who's coming thinking they have got all the right knowledge, when in fact no, and they have sourced it from less credible or non-credible sources, and they are so confused, and then the task becomes even more difficult to erase all the wrong information and then rewrite their script. So it's sort of very challenging. So definitely we have attained a lot of access to information, but whether that access is to credible information or not is a different story. Comprehensive sexuality education, which is another very important one. And then the relationship, the ability, the right to enter, the right to form or dissolve marriage or any similar types of relationship based on equality, and free and full consent is very important. Okay, so it's not a typical a male-female heterosexual relationship we are talking about. We are talking about a whole range of relationships, and then that's still very, very important to address that as a sexual right. And then comes, from Ojesian's point of view, the the right to decide whether to have children, and if they decide to have children, how much of spacing they need, and what information they have to have or not have, and then the means to do it. So that's a very important one as well. And then comes the freedom to express. Okay, so that is also part of sexual rights. And then the last three ones are not necessarily in the space of health, but still it's important sexual rights, which is the right of freedom to associate and peaceful assembly. Okay, so as a society, we have the rights to talk, we have the rights to assemble, and we can cultivate a thought, and we can promote from a positive regard, sex positive messages. So we should have the rights to do that. And then this is more of the right to participate in public and political life. This is where we can, the right for people who think they've been suppressed for many years, they can come together, they can lobby, they can express their view, and then lobby for it and advocate for their rights. And finally, the right, a very important sexual right, if you look at it, it has a direct connection to the very first one we talked, which is the equality. Everybody should have means to seek justice when their rights has been denied, or when their rights has been suppressed. So that access to justice and access to remedies is also part of sexual rights. So as you could appreciate by now, there's quite a lot. Okay, each one deserves a whole hour of discussion, not to learn everything, even to have an understanding. So there is no way in 20 minutes we can know every aspects of the sexual rights, but it's important to know what are these major themes. Now, I said I have a reason why I have put a red border. Any of those rights that has a red border is where sexual consent plays a big role. Okay, so say for example, sexual health, say for example, spacing of children or having children. So, and the partnership, the ability to enter or dissolve or be. So, and violence, which is a major one, and free from any form of torture or punishment. So all of this has got a significant role to do with consent, right? So I'm not going to read this again. This is all in there. Now let's look into what is consent, okay? Consent has two things. One is agree, and the other one is permission. So agreeing is when something is offered to you, you're agreeing to do that, and then you're giving permission for something to happen. So you need to understand the agreeing and permission aspects of consent. Now, consent cannot be given by someone who's under the age of 18. So this is the reason I have put the age in red color, because it changes from jurisdiction to country. In Australia, it's 16, whereas in India, it's 18. And consent cannot be given for in any other of those conditions listed there. If it's been forced, if under the intoxication, under the influence of alcohol, if it is affected by drugs, or when the person is asleep, or when they are unconscious, or if they are incapable of saying no, even though they are above the age of 18, if they're not capable of saying no, then that will be, and there's Dr. Jamuna Devi as a medical legal, I'm sure you will be able to relate to this aspect of sexual consent. And couple of do's and don'ts, we sort of incorporate consent in our day-to-day sexual health promotion is consent. And in especially the part where we come from, there's a popular thing, maunam sammadam. Okay, if a person is silent, it's taken as a crude indicator of saying yes, which is definitely not. Okay, consent has to be for any sexual activity, and everyone needs to give their full consent, and it has to be communicated openly and clearly. We cannot use certain body languages, or we cannot use silence as an indicator of yes. So it needs to be communicated, and it needs to be given for each and every sexual activity, even though if it is the same person, that doesn't mean it's a open yes, as a blanket yes, right? And consent should never be assumed based on past sexual activity. Things could have changed between the past and the present activity. And everyone has the right to change their mind. Just because they said yes yesterday doesn't mean it's yes today. So people should have the right to change their mind. And consent is never ambiguous. Okay, so that's something very important. Now, let's look into 3 scenarios. sexual right within fertility care. So I had a young woman who was referred and by a gynecologist, and the note was, could this be a case of vaginismus? Now, from a very low socioeconomic status, the women came in. It was quite a challenge to make a talk because of women talking to a male clinician. It was a little bit of hesitance, but then also the fear, oh my God, I'm going to be told certain thing. And then after cutting the long story short, she got married to her own maternal uncle, who's almost 37 years. Okay, so the maternal uncle used to be the father figure for this girl when her father passed away when she was very young. So the mother's brother played the father role in the family. Now that maternal uncle's wife separated, so the maternal uncle became single. The mother had 2 girls, so she thought she will marry the first girl to her own brother. It was a forced marriage. The gynecologist thought it could be a case of vaginismus because the couple were not able to have penetrative sex. What comes to your mind as a clinician, as a medical legal person, or as a human being, as a woman? What are we talking about here? It was very hard to take the history, but would be nice if we are doing a workshop, we can have a whole case study discussion, but unfortunately, this forum doesn't allow. So to cut the long story short, it wasn't a case of vaginismus because one of the defining features of vaginismus is involuntary spasm, whereas here she was on purpose doing everything not to allow penetration, because this is exactly her words, quote unquote, I obviously in Tamil, none of the decisions in my life I had a say and nobody listened to me, but I know there is one thing I can stop, and that is intercourse. So I'm not going to let my father figure to have sex with me. So that's consent, very important, right? Now, moving from the low socioeconomic status to a very high socioeconomic status person, a 29-year-old male, and remember this was back in 2013, right? Before homosexuality was decriminalized. This guy, he got married and he came to me asking, how can I make my wife pregnant without having sexual intercourse? Once again, cut the long story short, he did not disclose his orientation. He fulfilled his parents' wish to get married to a girl. So he hid certain things. He got married and then it became a marital disharmony. And then cut the long story short, once again, consent was a big issue. And not only consent, there were so many sexual rights that were breached in this particular scenario. Okay, and definitely it didn't go anywhere closer to falling pregnant. Now, sexual right within relationship. This is another scenario. Okay, so we talked about fertility first, then we look into the relationship, which Dr. Sanjay Deshpate is going to talk a lot about marital rape. So this is a newly married couple, grand marriage, as you would know in what we do. And the marriage got nullified in 3 months. You know, relatives all talking this issue, that issue, she's not obeying, all those things. Cut the long story, the core issue was sexual problem. He performed anal intercourse on her on the first night without her consent. Okay, for him, he was fantasizing it all his young life. He wanted to do it. And when he got married, he thought marriage is a blanket consent. He jumped on and ended up in bleeding, ended up in a lot of pain, went to the gynecologist, they treated the pain, they treated the bleeding. Nobody counseled the emotional side of things. For her, a man whom she married could not even listen and understand what she likes. She stopped trusting him, and she could not think of a life that she could live with him for the rest of her life. So trust was breached. Once again, sexual right breached. Sexual right and pleasure. Once again, another scenario. So this is a current couple that I'm seeing. So they've been married, and this guy has a high desire and he likes to be sexually adventurous, but the woman he got married had a history of child sexual abuse, but he was very nice. He was okay. That's all right. If you have, I can understand. But now he's putting undue demand on her to come and experience and be sexually adventurous as him. And the reason he's quoting is, because I've forgiven, I have accepted for with all your past things, you need to fulfill my expectations. So once again, sexual rights is not upheld in the scenario. Okay. Now, there are different models, but in sex therapy, when we deal, we use, this is one of the models. And the reason I'm putting this is permission. So consent is not just between two or more individuals. Consent is also important when we as healthcare professionals deal with our patients. And whether we, even before talking anything medically or anything to deal with treating the underlying problem, the first and foremost is granting permission for people to open up and talk about their concerns is half therapy done. So having that permission granted and able to listen to them in a non-judgmental way goes a long way. Okay. And then permission is not just one off and forget. It has to be wrote in every aspects of the care. Now the 4 pillars, I'm very mindful of the time. Now, if you haven't had a chance, this is a quick 4-5 pages document. Please, I've given the link there. Please do get it. And it's an open access, but this is one of the most beautifully written article in the Lancet. And it talks about sexual health, sexual well-being from a public health point of view. Okay, so let's look into the sexual well-being. So 7 key elements of sexual well-being. Okay, safety and security, respect, esteem. Okay, how a person feels about themselves, how to give and get respect, how to feel safe and secure. Okay, so that's about one side. Then comes comfort. Okay, how comfort am I feeling to be in that sexual situation? And that's very important. Okay, so comfort is how do I feel ease? Okay, am I feeling comfortable to say no? Am I feeling comfortable to have a conversation? Am I feeling comfortable to experience everything that's happening? So comfort is very important. And determination. Okay, what sort of, whether I have a choice, whether I can freely make a choice, whether I can accept or reject a partner, whether I can accept or reject a particular practice. And remember, in the case scenario we saw, if the girl had the determination that, yep, I don't like this, I'm not engaging with that, then that's what we call it as determination. Okay. And then comes resilience. Okay. Resilience and forgiveness. We talk quite a lot in therapy. Okay. Resilience is very important because not everybody having a sexual dysfunction going to experience distress in the same way. Okay, some people, yes, I have a problem, but still I can work with it. Okay, I can see all the other things in my life happening. So some people have, but not everybody. And forgiveness is not necessarily forgiving the perpetrator or anything. Forgiveness is about self as well. Okay, a lot of clients do come with self-blame and self-stigmatization and self. So they come with a lot of avoidance and aggression. So resilience and forgiveness is mainly in the therapy work, in the clinical setting. But the focus I would like to get is when it comes to determination and comfort, that's where sexual consent plays a significant role. Okay. The ability to say yes or no to a particular partner or particular act of sex is a very important element. Right? So these are the different domains. So my 5 takeaway messages are: sex is not equal to intercourse. Okay, I've become a big advocate of this particular equation because when people talk about the discourse of sex as intercourse, and they don't consider anything that's happening before that as part of sex. Okay, sex is not just about intercourse. Sex includes intercourse. And marriage is not a blanket consent to have sex, and which is what Sanjay is going to talk about it. So then remember the 4 pillars: sexual health, well-being, pleasure, and justice. It is the justice is where sexual rights is covered. Sexual rights must inform SRH care. Yes, the person sitting in front of us is the most important when it comes to care, but it's important to uphold the rights of that person. And probably if it is a couple, we need to be able to address the rights of 2 individuals in the care of us. And permission is critical in sexual and reproductive care. Okay, so on that note, I will finish it off and give back to the team. We can't
Thank
hear
you so much. It was a wonderful talk. You just talked right from definition, what are all the rights, equality, liberty, and so many things. You explained it so patiently, one by one. And the consent, the 2 parts of the consent, you really, I think today I learned it, the 2 parts. That is to agree and permission is 2 different components. And the 4 pillars and the scenarios was very wonderful. Why we need sexual health, that shows the importance of that. The scenario was well explained. When we come to us, such patients, we really don't know how to counsel them. And the sexual well-being, what it is, you explained it so very nicely. And it is a revision for us. It was eye-opener for me. And was a really, really wonderful talk. Thank you so much.
Thank you, ma'am. Thank you. Thank you.
Thank you, Dr. Karthi, for giving that wonderful deliberation on sexual rights, which is really a very important aspect that as a women forum, we all appreciate your a lot of information that you have given about sexual rights, especially in our clinical practice, how we look upon all the patients and how we have to look into all their emotional feel about their rights, which we have to take them into that confidence of getting everything about their sexual rights and insisting them on, making them well empowered with their sexual rights awareness. Thank you for sharing that wonderful thought of yours. Thank you so much.
Thank you. Thank you, ma'am.
Over to chairpersons.
Ma'am, if it's okay, I might take a leave. It's a bit late now, but I'll definitely, I'll pass on that presentation to you, and I'm happy for that to be circulated. Yep.
Thank you. Thank you.
Thank you. Thank
So
you.
much.
So that was a
Thank you.
wonderful, lucid, and very beautiful presentation.
Thank you, ma'am.
Well,
Thank
really,
you.
would love
Thank
to have the presentation also. Thank you so much.
Thank you, ma'am. Bye.
Madam, you can introduce sir, Sanjay, sir. Kundavi, if you're there, you can introduce.
Who's Dr. Sanjay?
Yeah,
Dr. Kundavi?
Yeah, it's my pleasure to introduce Dr. Sanjay Deshpande, a past chairperson, CSPI, since 2017, and Assistant Secretary AOPS, mentor from 2023 to 2021 to 2022, Vice President IMA Maharashtra 2017 to 2018, Honorary Secretary Indian Andropause Society, past President IMA Nagpur, recipient of Golden Lamp Award, Best Honorary Secretary of IMA at state and national level, Best President of IMA at state and national level, and Dr. Suresh Nadkarni Award for Articles on Sexual Medicine by IMA Maharashtra, Sunrise Peace Missions Yogi Mohanawar Sevaratna Purusha Award. Over to you, Dr. Sanjay.
yeah, thank you. Thank you very much, respected chairpersons, for allowing me to speak on this very important topic. I just want to share my screen, my presentation. So at the outset, I must thank Dr. Jayarani Kamaraj for giving me the opportunity to talk on this very important topic. Though this topic is very new for all of us, even for me also, I can share how I started working on this topic. That what happened, few of the social organizations in Nagpur, in Maharashtra and India, they wanted my opinion regarding marital rape in last, I think it was during COVID time, mostly 2021. And then I started studying on it. And I saw this is the topic which is of very much interest to all of us as a healthcare workers, as well as we are working in sexual medicine, human sexuality. And this is a very rare topic which has not been addressed in our culture till now. I am saying in our culture rather than in our legal system, because many times the legal system is not that important as the cultural or societal system is. So we have to understand from the societal view also that what we should do to reduce the problems of such type of, I would definitely say, heinous crime. So to start with, marital rape refers to the sexual intercourse between a man and a woman who are legally accepted as husband and wife, where the woman does not give consent for such intercourse. Rightly told by Dr. Vijay Sarthi Ramanathan before me, that marriage does not entitle the consent forever, always. Being a part of the wedlock does not permit the man to be forcefully have sex with his wife. And what we feel is that the spousal rape is more appropriate term than, because it's gender neutral. Nowadays, we know that many times the spousal rape or the rape is maybe reverse. It may not be a rape, because we know that I also spoke many times that there was a movie way back around 25, 30 years. I heard about that movie's title, that men can't be raped. And it's obvious. If a man gets erection, he will perform sex, even if it is forceful or it may be in compulsion. But when he gets aroused, then only he gets erection. And if he gets an erection because of his arousal, it means he was desirous, and because of that, that cannot be considered as rape. But as now, as the definition has changed, a sex with compulsion or force also can be called as rape. So we should take it as a spousal sexual violence rather than anything else. Because of the Indian scenario, I can say that definition of rape under section 375 of the Indian Penal Code 1860 states that sexual intercourse with a woman would be constituted as rape if it is against her will or without her consent. The consent of the woman is obtained by coercion or causing apprehension of grievous hurt or death. It will also be called as rape. If a man fraudulently makes the woman believe that he is her husband and has intercourse with her, that is also rape. So rape is not only just sexual intercourse. If a man has sexual intercourse with a woman who is unable to give consent due to unsoundness, then also it will constitute as a rape. Marital rape is also known as sexual intercourse with a girl who is under 18 years of age would also be called as rape, even if the girl consented for sexual intercourse. Section 375, the provision of rape in the Indian Penal Code, mentioned as its exception clause, sexual intercourse by a man with his own wife, the wife not being under the age of 15 years of age, is not rape. So in marriage also, if the age of the wife is more than 15, then it is considered as a normal sexual intercourse. It is not considered as rape. So that is the point which we wanted to object. All the child marriages in India comes under the rape or child sexual abuse. Now age of marriage is 21 years in both the males and females. Now my simple question is that where there are a lot of child marriages to the tune of more than 15% in many northern states, how can we say that marital rape is not common in India? Just by the definition of it, the girl who is marrying less than 16 or 18 years of age, every sexual intercourse can be considered as marital rape. Now, marital rape in itself is a type of domestic violence. It is an act of forceful or violent control and thus sometimes include physical abuse, emotional abuse, mental abuse, social abuse, financial abuse, and uses of male privilege. Effects of marital rape. Marital rape has more severe and long-lasting consequences for women because of the simple fact that rapist is no more or none other than her husband, with whom she had expected to spend a lifetime of happiness. Now, this is WHO on violence against women. They call it intimate partner violence, which refers to behavior by an intimate partner or ex-partner that causes physical, sexual, or psychological harm, including physical aggression, sexual coercion, psychological abuse, and controlling behaviors. Why this is in need is because not only marital violence, rape, but nowadays there are few people, may not be many, they have started living in relationship. So for that also intimate partner violence should be a proper terminology, or spousal sexual violence can be a proper terminology. Now, what is sexual violence? It is any sexual act attempted to obtain a sexual act or other act directed against a person's sexuality being using coercion by any person regardless of their relationship to the victim in any setting. It includes rape, defined as the physically forced or otherwise forced penetration of vulva or anus with a penis, other body part or object, attempted rape, unwanted sexual touching, and other non-contact forms. So it's not necessary that it should be only the penovaginal or penoanal insertion. So this is all about the violence and marital rape in the whole world. Now, why country to country comparisons of rape statistics are difficult? Because some countries consider any non-consensual sex to be rape. Others classify a sexual assault as rape only when it extends to a certain threshold of violence. Some countries acknowledge spousal rape also, others do not. Some countries count any report of rape, others count only those incidents that proceed to a legal trial. Some countries include non-consensual and sometimes also consensual sex with minor. Other countries place any sex with minor, consensual or not, into rape, into separate category. So it is dependent on the law and the various, indications in the laws, which will make the rape statistic different and maybe less or more in many countries. Some countries confine the definition of rape to forced vaginal penetration during sexual intercourse only, while others consider any unwarranted penetration of the mouth, anus, or vulva with any body part or object to the rape. Some countries track only male on female rape. Others also track female on female, female on male, or male on male rape also. Some countries count each individual assault that occurs between the same people. For instance, a child and a relative, or a man and his arranged fiancé has its own separate incidents. Others add all the incidents together and count them as a single rape. Similarly, some countries count gang rapes as a single incident regardless of how many individuals participated. Others count gang rapes as multiple incidences. So the statistics, I just wanted to make you aware that how the statistics from different countries may be different. The violence against women, particularly intimate partner violence and sexual violence, is a major public health problem and violation of women's human rights. Sexual rights will be later, but it's violence of the basic human right. Estimates published by WHO indicate that globally about 1 in 3 of the women worldwide have been subjected to either physical and sexual intimate partner violence or non-partner sexual violence in their lifetime. So the problem is huge, and most of this violence is intimate partner violence. Worldwide, almost 1/3 of women aged between 15 to 49 years who have been in a relationship report that they have been subjected to some form of physical or sexual violence by their intimate partner. Now, violence cannot be negatively affect women's physical, mental, sexual, violence can negatively affect women's physical, mental, sexual, and reproductive health. It's not only physical or mental, and that may increase the risk of acquiring HIV in some settings. Violence against women is preventable. The health sector has an important role to play to provide comprehensive health care to women subjected to violence as an entry point for referring women to other support services they may need. And here I think the Organic Society, Foxy, and all other Foxy committees and societies must educate and must tell their members that they should take this, the cognizance of this such type of heinous crimes in the marital setup, educate the women, educate the man, if possible, or otherwise encourage the woman to take the legal help also. So these are many statistics available. They said that poor women are more prone to sexual violence than from spouses. Maybe because of high income, because of high status in society, the parents are considered as protected of that woman even after the marriage. And because of that, the chances of sexual violence are less. So today, marital rape has been impeached in more than 100 countries. But unfortunately, our country is one of the only 36 countries where marital rape is still not criminalized. Now, when is rape is allowed by law? More than 2/3 of the women in India, aged between 15 to 49, have been beaten or forced to provide sex, regardless of their socioeconomic status. 1 in 5 men has forced his wife or partner to have sex. So we have to see the severity of it. We have to understand the severity of it. Now, why people don't understand that marital rape is an important? There are 5 reasons. That marriage does not give an autonomy for a man to have sex with a woman at any time. Husband does not own the body of his wife. She and only she has the right to decide when she wants to have sexual intercourse or any kind of sexual relationship. If he says no, he has to stop. But if he does not, it's a rape. If physical violence is illegal, how come sexual violence is not? This is very strange. A husband can be jailed for beating up an abusing woman, but not for raping her. Why is it crime for a man to physically assault his wife, but not sexually? This is a very problematic distinction from assuming that wife's sexuality is husband's property. This is argument that husband has a right over his wife's sexuality. That is wrong. Consent is very important in marital sexual relationship also. No institution is above an individual's dignity. Now it is said that the institution of marriage is founded on one partner signing away their physical and sexual autonomy to other. That's not marriage. Then that's subjugation. Any institution that degrades and dehumanizes an individual should indeed be destabilized. So a more equal institution can take its place. Now there is another favor in opposing marital rape is that if marital rape is criminalized, then the husbands will be victimized. Now another argument at the center gave in court, which many other make, is that the law should be prone to misuse. It could become an easy tool for harassing husbands. Now every law can be misused, and that cannot be an excuse for making new laws. People have been falsely accused of murder. Does it mean that murder should be criminalized? Should not be criminalized? Now, there are factors associated with intimate partner violence and sexual violences against women. Low level of education, history of exposure to child maltreatment, witnessing family violence, antisocial personality disorders, harmful use of alcohol, harmful masculine behavior, including having multiple partners or attitudes that condone violence, community norms that privilege or ascribe higher status to men, low level of women's access to paid employment, and low level of gender equality. Factors specifically associated with intimate partner violence are past history of exposure to violence, marital discord and dissatisfaction, difficulties in communicating between partners, and male controlling behaviors towards their wife. Factors specifically associated with sexual violence perpetration is that beliefs in family honor and sexual purity, ideologies of male sexual entitlement, and weak legal sanctions for sexual violence. There are many health consequences also: homicide or suicide, injuries, unintended pregnancies, induced abortion, gynecological problems, sexually transmitted diseases, including HIV. Women who has been physically or sexually abused were 1.5 times more likely to have a sexually transmitted infection, and in some regions HIV, compared to women who did not have experienced partner violence. They are also twice as likely to have an abortion. Intimate partner violence in pregnancy also increases the likelihood of miscarriage, stillbirth, preterm delivery, and low birth weight babies. The same 2013 study showed that women who experience intimate partner violence were 16% more likely to suffer a miscarriage and 41% more likely to have a preterm birth. So it do have health consequences also. Depression, post-traumatic stress, anxiety disorders, sleep difficulties, eating disorders, suicidal attempts. The women who have experienced intimate partner violence were almost twice as likely to experience depression and problem drinking. Health effects can include headaches, pain syndrome, gastrointestinal disorders, limited mobility, and poor overall health. So these are the things which we as a clinicians, you as a gynecologist, we can definitely suspect of something, some sexual violence, some intimate sexual violence, some sort of marital coercion that is taking place. We have to doubt in such situations. Sexual violence, particularly during childhood, can lead to increased smoking, substance use, and risky sexual behaviors. It is also associated with perpetration of violence for males and being a victim of violence for females. Psychological effect: the trauma a woman goes through when her own husband repeatedly rapes her cannot be explained in words. The psychological effects are far worse than the physical effect. Some of the short-term psychological effects are shock, fear, stress, suicidal tendency, etc. Depression, post-traumatic stress disorders. There can be impact on children also, because when the rape is in marital context, in relationship, even children will also suffer. Children who grow up in families where there is violence may suffer a range of behavioral and emotional disturbances. This can be associated with perpetrating or experiencing violence later in life. Intimate partner violence has also been associated with high rates of infant and child mortality and morbidity. Social and economic cost. The social and economic cost of intimate partner and sexual violence are enormous and have ripple effects throughout society. Women may suffer isolation, inability to work, loss of wages, lack of participation in regular activities, and limited ability to care for themselves and their children. Now, how can we respond and prevent this? This can be prevented through relationship skill strengthening before marriage take place, empowerment of women. We have to ensure the services if they are suffering from such type of marital sexual violence or spousal sexual violence or intimate sexual violence. Reduction in poverty by giving employment and wages to them, enabling environment, school, workplaces, public, child and adolescent abuse should be prevented, and transport attitudes, beliefs, and norms. Now, role of health sector is advocate to make violence against women unacceptable, provide comprehensive services, sensitize and train healthcare providers in responding to the needs of survivors holistically and empathetically, prevent recurrences of violence through early identification of women and children who are experiencing violence and providing appropriate referral and support. So its onus is on us also. As in POXCO, the physician and the treating medical practitioner is compelled to report to the police. We can have similar laws in preventing marital rape too. Generate evidence on what works and on the magnitude of problem by carrying out population-based surveys or including violence against women in population-based demographic and health surveys. Now, as a sexologist, I have few concerns, whether it's consent, wish, or desire. Maybe consent is there, but she is not willing to do it right now. Or maybe the desire is there, but she is not ready to participate in sex because of many other conditions. Why she is not desirous of sex, pre or extramarital relationship, any problem with husband, any problem with in-laws, any sexual problem with husband or herself. There are many factors which plays an important role, at least in India. The husband and wife role in Western countries is very, you can say, separate. Many other factors as they operate in India, they are not present in such circumstances in Western world. But in India, we have to look the situation comprehensively, holistically, and in toto, whether she is not allowing deliberately because of many of these reasons. Many times women they want to get the things done by the husband. And that's why if the things are not getting for them, they withhold. Now, marital rape, these are my few legal, family, sexual, and social consideration. Rather than marital rape, it should be called as spousal sexual violence or intimate sexual violence. This term will cover both the aspects of cohabitation of male and female. Due to complexities of marital relationship in India, spousal sexual violence should be included in Domestic Violence Act. We are suggesting that it should not be a separate act like rape, and a male should not be punished unless and until there is an evidence of some another part of domestic violence. Sexual violence within marriage should be considered violence only if it is associated with some sort of physical violence. Also, injuries to the genital parts of the wife should be must to prove rape. It cannot be like the general definition of rape, where penetration of penis is not to prove rape. It will be difficult to define consent in marital relationship, because still most of the India, where 70% of the India reside in rural area, while 30% only in urban area. The low economic status, the educational status, the financial status, these are many aspects which are important, which will make everybody difficult to define consent. Apart from consent, readiness to indulge in sex, desire of sex, and wishing the sexual intercourse are a few considerations which could be taken into account with consent. For example, a wife is desirous of having sex but is not willing to do sex with the husband due to his undesired behavior or any other reason which may include her own problems too, and hence not allowing him to perform sexual act. So how can we find out the reasons for this? How many times husband is forcing wife for sex is also an important thing. If it is a few occasions in the marital life, it should not be considered as rape, but rather than punishment, remedial actions through counseling is better. In case of repeat offenders, of course, the punishment can be given. As the law should be general, gender neutral, can a man also complain of his wife for forceful sex? Can it be considered as rape? Whether man can be raped? At the start only I took this question. India is not much gender-friendly society. We still are biased about women behavior. If this law is made, what will happen if lakhs of women complain about marital rape in marriages? Do we have enough government and judicial machinery to handle this burden? For this, we need to take social actions like sensitizing the young males about desire and consent of their wife. Premarital counseling will also be an effective tool to tackle this problem. Just like this Supreme Court's observation about booking up thousands of cases for child marriages, this is a social evil and we need to wipe it out only through education. All the child marriages will be included under marital rape, and many women may start complaining after they are 21 years or above. Will we book all their husbands for marital rape? Sorry about this slide, but I will go with that. Spousal sexual violence should be like Domestic Violence Act, whether proper counseling by the expert should be made available to the complaining wife and her husband. This law should not be punitive, but helping the couples. Spousal sexual violence, if associated with physical violence, then only the case should be sent to police. Sensitization of all the stakeholders essential in our country. The sudden implementation of this law will create havoc in our country. Instead of criminalization, sensitization of family members and men is important. The mother also should be educated to avoid gender discrimination regarding the sons and daughters. We always discuss about the mental trauma of children of divorced couples. What will be the psychological effect of such children where father is facing criminal charges of raping his own wife are yet to be assessed? How society and family members will be affected by this is not known to us. When denying the sexual pleasure can be considered as cruelty in granting divorce, how can it be considered as rape in case of non-consenting wife? It's often said that sex is used as a weapon in marital relationship. Most of the times it is offered or denied to get something or due to not getting something respectively. How can these intentions be known by the third person? In case of erectile dysfunction, men also can say that he is not desirous of sex and complain about forcing him into sex. The entire society feels that he should do sex with his wife, and if not done or unsuccessful, he is considered as namard or important in our Indian society. Can marriage be then considered void? If the man is important and the wife files a suit for divorce, does consent of a man also will be considered in this law? So it may be misused like domestic violence. It may be a double-edged sword. Denying sex is considered as cruelty. This I already showed. So can this law, if made, will be gender neutral? So these are all my considerations, legal, marital, social consideration that we have to address. Now, my few suggestions to avoid or prevent spousal rape is that we have to start sexuality education to both boys and girls. And specifically, I'm advising at all fora. Yesterday also I spoke in a function, a social function by an NGO about consent and all. The main point is that we have to make our boys gender sensitive, gender friendly. And it can be done only when we start educating them in the early years of life. It can start when we educate them in the family setup, not by going to schools or colleges. And it will be very, very late in that sense. So gender education and sexuality education, both should be given, because it is proved now that if sexuality education is coupled with gender-based education, we can prevent most of the sexual violences. And premarital sex counseling. If the boy, but currently when there was no sexuality education in schools and colleges to persons who are married now, the male should be given premarital sex counseling with their partners, and men should be advised not to have sex unless and until the wife is consenting. Also, wife should also be educated in the same way. I think if we follow this, we can minimize this menace of marital rape to the large extent. I think my time is also up, so I should stop here. So thanks again to all the organizers and especially Dr. Jayarani to involve me in this very important international webinar. Thank you. Thank you very much.
Thank you, sir. Over to the chairperson, Madam. Hepzibah Madam Shanti, Madam.
Thank you very much, sir, for your excellent talk. You have indeed said that India needs to change its policy regarding marital rape, and gender sensitization is very, very important at a very early age. So it very well said, sir. And
Thank you.
So now we go on to the next program, which will be a dialogue on sexual health and consent. So we have two good interlocutors for that. Dr. Kiranmai Devineni, who's a professor of OBG, GMC Vanapati, and Kaloji University of Health Sciences, Telangana. She has, as a chairperson to FOXI No to Violence Against Women, she has been really very active and has done a lot of programs. And she has been a Kamini Rao Yuva FOXI Orator 2013 and lot of other awards too. And she has been a peer reviewer and a scientific convener for all these AICOGs, which were really very good. And she is a trainer of trainers for multiple things like MCGL for global maternal perinatal death surveillance response workshop, then PPIUCD, Dakshata, and UNICEF gender-based violence. So we are really very happy to have you here, Dr. Kiranmai. Welcome.
Thank you, ma'am. Thank you for the kind words.
Pleasure inviting the next person, Dr. Jayarani Kamaraj, who has been the person behind this international webinar. She's a vociferous activist of women's sexual rights since long. She has been doing lot of programs since long, and she has made a mark in the world map too. She is an Associate Secretary, World Association for Sexual Health, Advisory Council member, World Association for Sexual Health, and of course, our dynamic President Oxy, Chairperson Sexual Health Committee, TNFOG, Treasurer Tapisar, and member of Board Studies. And she has actually academically also, she has won lot of medals, and she's a recipient of innumerable awards as a very active woman doctor. So I welcome both of you all for this program.
Thank you, madam. Thank you for the kind introduction. I thank all the faculties here and all the international and national people to join hands with me for making this webinar a grand success with all your academic and your expertise. And now today we'll be can you see my screen?
Yes, ma'am, but can you please make it in full screen, ma'am?
Is it okay?
Yes, ma'am. Perfect, ma'am.
Perfect. Yeah. So I thank Kiran for joining me to have this dialogue on the very important part of this Sexual Health Day. The theme for this year is the consent. We all know that from 2010 onwards, World Association for Sexual Health has made this day to create an awareness among the all over the world globally, to bring forth the sexual medicine to become a very much talked subject, so that every part of the world can join in this to talk about sex. That's what's the first thing. Let's talk about sex. So that was the first initiative that has been made by the World Association for Sexual Health to bring this sex, which has been considered as a myth and taboo, to talk freely among all over the world, to make everyone know about it with a scientific way, and bring forth a lot of changes in the humanity, especially women, we women, because when you look into the sex as a gender focused way, the women are the persons who have been most affected by every aspect of the sexual life. So with this view in mind, I really thank World Association Sexual Health to bring this day to create an awareness among the sexual health all over the globally. And this year, every year they bring something to create an awareness. And this year we have the consent. So we all know a consent, because as a doctors, as a gynecologist, we know that we have the consent, and we know it is an informed consent from our point of view. So the consent is not just the permission, but in the point of view of the sexual health, it is a permission of anyone touching your body. That is what the permission means. It is actually not the partner alone, but anybody touching the part of a human of your body should be given a permission to be touched. So that is a very important component, because many a times in a gender-based violence and gender-based, a lot of social issues, the consent is the one which is lagging, and which is the one which has made a lot of issues among the sexual life. So to make this very clear, the World Association of Sexual Health has made this point a consent as an important theme. So a consent is a permission. No one can touch the other person's body without the permission. And all partners, either they may be a married couple for any number of years, but still for the sexual activity or anything to be touched, it should be done with a permission. And when you look into the Indian Penal Code, the section 375 states that the consent is the unequivocal voluntary agreement when the women by her, it is all by her, not by the words alone, or it's by words or gestures or any form of a verbal communication, that it should be very much specifically should communicate the willingness to participate on the specific sexual act. That's what the Indian Penal Code IPC 375 says. Essentially, this definition contains that consent is a voluntary agreement that is given by a woman within the context of the sexual act. That's what the consent says by the IPC. So consent, though we have a lot of consents, different aspects of consent, like consent, affirmative, enthusiastic consents. There are very many ways of consent, but this consent, what we mean is a agreement given by the women within the context of the sexual act. So that is the consent definition, what we see. And then if you look into the consent, is it about the sex or the penetrative sex alone? No. It is always a consent of every activity related to the sex. It could be a kissing, or it could be a hugging, or it even could be a sharing the food among the partners, or touching any part of the body, or exposing their genitals, or talking or taking or sharing the sexual photos, videos, sex texts. Everything needs to be a consent. So it is also very important that not only the sexual penetrative sex, but non-sexual scenarios as well as play a very important role in getting the consent. So it is not the elderly or the older ones. It is right from the first year to 101 year. Every human have to be deservingly see their body autonomy. So there are very many things that if you live for more than 50 years, still when you want to have a touch or a sex with your partner whom you're living with more than 50 years, you must get a consent. And it is not only the elderly or the older one, but also we should talk about the consent and also start talking about the consent to the younger children, which is always very important to start from that age, which will cultivate in them the very important morality of getting consent for every act they do for the other one. So in that way, the consent starts even at first year and goes up to any number of years they live. And it is always very important to insist on the point of the consent, when to start, how to do, what are all the consents that you should get. Everything about that is the main theme to work on this year. So to put forth, to understand about the consent, they put as a simple way that the phrase, the FRIES. So F, the consent should be given freely and willingly. It should not be a consent which done under pressure or a manipulation or in the influence of a drugs or in an addiction or in a inebriation or an alcoholic way. It should not be given, and it can be reversible, because sometimes you say S for sex and suddenly when you're doing it in between, you don't want to do it sex, you don't like it, you can stop it, you can say no. So it is reversible. Just because you said S and started doing it, it should not be stopped in between as people wrongly think. It is not so. It can be reversible at any time. The removal of the consent can be done at any time during the act of sex. That is very important. And third, the consent should be an informed consent. You must do only a consent to something if you know about it full story. For example, in our practice also, when we do a consent, it's an informed consent. When we do a procedure, we tell them the full part of how we are going to do, what are all the expected complications, how we do it, what is the outcome, everything. We tell them the full story, and then only we'll get the consent. That's an informed consent. So in sex also, it is also very important that you should say about your entire history, whether you have a previous STI or you have a previous problem, or whether you want to use condom and how you want to do. Everything should be properly informed and taken a full history, and that is very important in the sexual act. And secondly, enthusiastic sex. Enthusiasm is not that, oh, I want to do certain things. It is all that, not the enthusiasm alone. It is all, you have to be absolutely convinced or absolutely made pleasure about it. That is a very important about the enthusiastic consent. And specific, every act of sex, like even a kissing or a hugging or a patting or a tapping or anything, should be given a specific, specific content. What are you going to do? That will be the very important part of the sex. So it is always very important to agree that what type of sex you are going to do, and that should be very specific when you get the consent. So these are all the various important aspects of the consent regarding the sexual act. And also how to ask about the consent. they have given a various norms in the WHO standard way, how to ask, whether it should be a holistic approach they have given, what are the ways that you should ask, should talk, and how to have everything has to be in a proper way. That is a way that they give. Sometimes there are natural ways of to ask the concern without changing the vibe or feeling of oddly formal. Because sometimes it should be very difficult to, in a sexual life, whether to how to ask about it, how to put the word of the penetrative sex, everything will have a lot of difficulties in expressing certain things. So we can have a proper a norms like thing to convey. Are you very happy about it? Or you're very comfortable about it? Can we try? Like this, we can ask for the consent. So that is a very important one. And interestingly, if you look into the consent, it is all we are talking about the sexuality or the sex. But is it consent only applies to sex alone? If you say yes or no, no, it is for everything. But here they talk about sex alone, but it is not only sex. It is always applies to many other social interactions that come into the social life of any human. And that is a very important one about the sex. So I would like Kiran to talk about all the other social aspects of sex, consent, how it acts in the life of any human in various content of the life, starting from the younger age to the adolescent, how consent play a very important role in the social uplift of any human. Over to you, Kiran.
Thank you, Dr. Jairani. I think every talk today was really an eye-opener. I need not stress upon the importance of the topic, and especially I was thrilled when consent was the theme for the World Sexual Health Day, because being part of the No to Violence Against Women Dhira initiative and being the chairperson, I somehow very seriously believe that if you understand consent in your relationships, and if you can get the young people or children understand consent, then the whole issue of abuse or non-consensual sex or rape or these understanding and misunderstandings, so many things happen. See, not all is done with a criminal intent. Most of it is done in ignorance, and when they don't understand these boundaries and all. So this consent, I think, is the key to so many things, not just sexual health and relationships, as you have told. So the consent is for every day, and it is an everyday consent. So as you have rightly told, it is not just about sexual relations, because by agreeing to take consent, by valuing the consent, we are respecting the privacy of other person. Like everyone has boundaries, and they're not the same for everybody. So for example, some people like to keep things about themselves private. It may be very silly issue, as if you understand. Suppose I share some private issue with my friend, and I expect or tell her in her or him in some way that I do not want this to be disclosed. And if that person goes ahead and discloses, then it is not respecting my boundaries. It may appear something very, not very important thing, or it is something which I am very closed person or a private person. It's not so, because I have told that this thing has not to be disclosed, or I want it to be kept in a closed private manner, and this is shared by you. That means you do not understand the boundaries of my boundaries. So there you are not respecting the privacy, and from there starts the disrespect and unconsented or non-consented behavior, which may spill over into your sexual relationships. I think that is the crux of the issue. So sex without consent, it is not sex, it is assault. And especially we do not address, especially in our movies, media, or in our conversations, we do not address how to handle this no. We are always given to understand that we should get an yes. And especially if you see our education system or our rank system or our success, the importance that we place on success, the importance that we place on success of your love affairs or dating or whatever it is. See, we never tell our children or young people or ourselves that we have to take no. So accept the answer and move on. Don't pressure someone to change their mind. That is against the rights of that other person. So it's okay to feel disappointed when you get a no, but always remember that respecting boundaries is the right thing to do. I think this is a fundamental issue that each one of us has to understand. Can I have the next slide? So this is a judgment by Kerala High Court. Actually, this was actually a assault, actually an assault between an older man and a 14-year-old girl. But he told that this girl had come with, visited my home. She did give consent. It was consensual relationship and all. In that case, the court has rightly observed that, that surrender due to any reason can never be perceived as consensual act of sexual intercourse, and it has to be obtained freely. Next slide, Jairani. So what I just wanted to say is we have to understand the nuance in consent. So mere as sir was telling in the beginning about one quote in Tamil about maunam, or that silence is half agreement, that also exists in Telugu. Like maunam is ardhangikaram. It is you are half agreed if you are silent. So we just take it so much because we grow up listening to all that. So absence of refusal is not consent. So negative, this thing is not consent. It cannot exist without deliberate positive affirmation. So we are moving from no means no to yes means yes. It's not enough to have a no. So it is always important to have a positive affirmation instead of an absence of negative. So consent implies a positive affirmation and yes means yes. Of course, no means no, but we have to talk more about yes means yes. A positive, affirmative, enthusiastic yes is what we are looking to it. This is, I think, a book which I came across when I was just reading about all this consent and all by Jessica Valenti. So to value female sexuality and pleasure leads to, I mean, this is one concept which I really loved. We are always talking about treating women as collaborators, as conquests. When we talk of marital rape, woman is my property, wife is my property. So from there, we have to talk of women as collaborators, and also to understand that women can enjoy sex instead of being shamed for it, and value female sexuality. I think that's what all sexual health is all about. Leads to women, it helps us to view women differently. So maybe if we go in this right track, our children can inherit a world where rape is rare and also swiftly punished. Okay, next slide, Jairani. So this is one thing which I wanted to say about in all your social relationships, right from growing up, right from when you are 3, 4, or 5 years of age. If the child is made to understand the boundaries and consent in your mutual relations, then that is the foundation. Then comes to the areas where there is an unequal power sharing, like workspace or your boss, or wherever there is hierarchy. So the lines between this personal and professional relationships generally tend to blur because you are working for so long, just as you are with your spouse, as you have given an example. I'm working with my colleague for 20, 30 years. That may lead to some blurring of boundaries, which should never be taken as a normal and healthy this thing. It's always you have to ask consent and respect the boundaries, even if you have worked for 50 years, 60 years, like sitting next to them, touching them, or calling each other beyond working hours. All these things, and making physical contact of any kind, whatever be the number of years that you know that person. You may be your best friend. So can I have the next slide? So when I'm talking of this power imbalance, this exists. We have seen in our wrestlers. I think we all were very much pained to see what happened to our sports women with their coach. I mean, that's a hierarchy, you can't question the coach, you can't question the president of that association, you will not be given your chances, you will not be listened to. So the same thing happened in Spain. So I'll come to that a little later. Like this is again previous slide. So can I go to the previous slide? This is like, some manager is there who is a male. Generally, it is gender. This thing is like men, mostly women are the victims or sufferers. Suppose he has put a meeting late evening or late night, and time and location are, you're not feeling safe. So doesn't give any choice to the employee, and the employee has to go. So, but instead of ordering, the act of asking whether it is meeting is convenient to you or the time and location is convenient to you, if the manager does ask the employee, that makes it very safe and equal, and the employee should have the right to refuse such a kind of situation. So this is about the consent in power imbalance where it gets blurred. You know, I'm the boss, I'm telling you, so you have to follow. So coming to the Spain football incident, the similar thing happened. Is the president of the Women Football Association, who is Mr. Luis Rubiales, and this player is Jenny Hermoso, who has won the world championship. And in that excitement, what he has done was this. So he carried her and then he kissed her on the lips. Then actually this was the tweet of that player Jenny Hermoso, who said, I didn't feel I was respected, and that's the whole point. And I clarify that at no time did the conversation to which Mr. Rubiales referred to take place, and that far from it, his kiss was not consent. In the same way, I want to reiterate, as I did at that time, that this incident was unpleasant to me. Actually, this raked up a lot of discussion, and he rejected, and many said it is normal. Why do you make a big issue of it? But now, you know, the Spanish equality minister, they have an equality minister. Spain is supposed to be very gender sensitive. I was really pleased to read about their, response and all. They have an equality minister, Irene Montero, who called this incident nothing but a lower intensity form of sexual violence. And I think he's being removed, this football chief. So this is the pictures which she shared, and she said that this is not consented behavior. If she had not raised this issue, nobody would have really thought it was normal, like, you know. So coming to the next slide. Again, coming to the children, we have in Indian culture, we carry kind of, we do a lot of things with children, like cuddling, kissing, even tickling. We did never think that consent is needed, because there the bond, it gets blurred for children, and they do not understand what is safe touch and what is unsafe touch. And when they grow into adolescents, they'll have this kind of things blurred. So they require healthy boundaries, and seeking consent from children before they are hugged or cuddled, it paves the way for teaching them body and autonomy. We can't teach body autonomy at 16 or 18 or 20 or 30. We have to teach them when they are young. This is one thing which concept I thought is very important. And children refusing to hug in our households, we take it as, you know, anything which is not done as per elders' wish is an act of disrespect, disobedience. No, actually, this is the child is claiming the autonomy. It is a very healthy sign, and it has to be appreciated. Next slide. So again, a word about our mainstream movies and pop culture. I think if you grow up, even the most beautiful of the movies have got this wrong. We had this Misamma movie, I think. Can I have the next? We have that song like Chuma Chuma, and so many. I can, we can say hundreds of songs, but this song always comes to my mind when I think of consent, like Aunante Kadanile, Kadante Aunanle. Like if a woman says yes, it is no, and if a woman says no, it is yes. Those are the lines of the song. And then Aduvari Matalaku Ardale Verule. That means if a woman says something, she means something else. This is something very really misguided and wrong concept to have. It has to be rescripted, like to say that no means no and yes means no, and a woman is a human. For her also, yes is yes and no is no. And hasi to fasi, we have so many love stories where a heroine smiling and laughing and accepting to come for a date is like it's equivalent to a girl falling into trap or love. So many tropes exist. It's a long way to go, but these are the 4 areas that the power imbalance, the children, and then the media, and then if you follow consent in every aspect of your life, with every relationship that you have, then it becomes easier to extend it or inculcate into your sexual health relationships. Next slide. And again, this one paper, it was this is a paper which studied 470 young single men who had convicted for sexual aggression in 2012. Actually, it was not the intent to rape or anything. It was found that misperception of sexual intent is one of the biggest. And when you see our POXO cases or young boys, you really will find that they have these misconceptions about love and consent and all. The study throws light on how unusually high numbers of perpetrators of sexual assault misinterpreted and misunderstood obvious cues that resulted in grave trauma for the victims. We have had a case in Jubilee Hills. I think it was a very high profile case. The girl had consented in a way. I mean, the way we had understood the news was she got into the car. there was some consent related to kissing and kind of, that kind of behavior, but that was taken as, yes for anything, and she was gang raped. That was because she had come from states, and so it was a very huge kind of thing. Next slides. So ultimately, I did not know, I had to ask. This is a question a lot of people have to tackle because they did not invite consent at the first instant. Next slide. So communication is two parts. One is knowing consent and then communicating it. So again, use the method of affirmative consent to ensure its explicit existence. Next. So again, we may think that all this kind of things may restrain your relationships or make it unnatural and all, but actually, on the contrary, presence of consent in every relationship will make everyone feel acknowledged, relationships respectful, and the world a safer and inclusive place. Next slide. I think these are your slides. I'll go ahead with 4 case scenarios. Next slide. I think very interesting case scenarios Dr. Jairani has. You can take over, Dr. Jairani, otherwise.
So as it is, as you rightly pointed out, your body have to be ruled by yourself, and you have the right about your body, and anything done to your body, which is always not the physical touch alone, the mental, and also every aspect of the human life has to be done with a consent. And definitely this consent will be a guide to your, as rightly pointed out by Kiran, that right from the younger age group up to the adolescence and even the adulthood, this should be a guide for a good relationship to be formed, for a good living to be lived, and also to be a good human in the life, which can be very pleasant to the others also. So in that way, Kiran has given a very thoughtful input about the consent of every aspect of the human relationship, which is a very important one, which we all should take it up as a way. Along with that, the World Sexual VAS has made this mainly related to the sex, because many a times, as rightly pointed out, a sex without a consent is like a sexual harassment or a sexual abuse. That's how it should look into it. So we must ask for anything, everything, like kissing, hugging, everything should be asked. And also even the sexting, sex testing, your WhatsApp messages, images, FB, everything has to be taken as a proper consent. Without a proper consent, doing this is definitely to be a offense. That is what you should be very cautioned about, getting the permission to do everything, for anything for that matter. So very interestingly, one consent says, if you have already a relationship or you are married, living with your husband, you have a monogamy relationship, but still you need to ask consent for every time when you do sex. Yes, it should be done that way only. It doesn't, your marriage or your relationship doesn't take it for granted that you can do sex as you like without a consent. So that's what even a long-term relationship still require a proper consent. Any number of times you would have had a previous sex, but every time you should ask for the consent. That is very important. And very interestingly, is the consent is reversible. Yes, you can change your mind to no after saying an yes and stop any sexual encounter, even if it is in between a sexual act. If you want to stop and if you want to say no, yes, you can say no. You can take up the consent. It doesn't mean that it should be done like that. So consent is always reversible. One can change their mind anytime, even if they've already said yes for that. What can help determine the consent than the verbal cues? You can use a voice tone or an inflection or a non-verbal communications like body languages, behaviors such as pulling one closer, taking off own clothes, which one is important, because all the above help to determine the consent. Consent is more about the language. The non-verbal communications like voice tone and behaviors can help one to communicate the consent, but not to be taken as a consent. It should be always a verbal and a proper consent. That should be very important. So very interestingly, we can look into the important part of the sexual consent, especially in a consensual sex. It doesn't go away about without a consensual. It is a partnership consent. So which of the following partnership require consent? Is it a single adult looking for the first time, or a couple who have been dating for more than many years, or a married couples? Everybody needs a consent. That is what they're very important. So consent is the key to all sexual encounters. Old and new sexual partners all require consent each and every time. So what is a sexual consent? A sexual consent is an agreement between the participants to engage in sexual activity. It should be clearly and freely communicated. A verbal and an affirmative expression of the consent can help you, both you and your partner, to understand and respect each other boundaries. That is how it should be done. What are the gender roles in the consent? Gender is not binary, but many people have been raised to believe that this is, and that the man and women should behave differently. That is what Kiran said last time. Because when you want, they feel that the woman is saying something, but she has in her mind and talk something. So that aspect should not be taken into consideration in the women, from the women's point of view. In many places, women have been culturally conditioned to be the people pleasers. They may have trouble standing up to someone and saying no because they don't want to hurt another person's feeling. That is what is happening in most of our Indian setup. Women may also be feeling afraid of how a partner will react to the rejection. So they may be worried about coming across the rude and the prudish moments, or they may even fear the violence which happens because of the gender inequality, especially in the sexual act. So we need to teach the women that it is okay to stand up for themselves and set their own boundaries. Everyone needs to be taught to respect boundaries, no matter who sets them. That's very important. So that is what it is very important. The gender roles and consent play equal to both the sex. It's not the men alone, it is for the women also. This is very important. That's what we insist in this consent. And second, gender is not binary, but many people have been raised to believe that it is, and that a man and the women should behave differently. In many cultures, in of course all the cultures, men are socialized to be confident, dominant, persistent, aggressive, and decisive, and commanding, and all the topmost qualities that the men feel that they have in the cultures. This pervasive narratives suggest that men prove their masculinity through their sexual conquest. That's what every couple feel. But if this is the view of sex you have been raised with, valuing a partner needs and boundaries may come off as a weak or unmasculine, which is not true. Talk to the men and the boys in your life about consent and teach them the consent is sexy, respectful, and very important, not mainly manly alone. So very importantly, we have to talk about the consent to the boys as well as to the grown-up adolescents also. So consent, and very important about the pornography. Pornography rarely shows consent. That is what it is very pathetic about the pornography. In fact, it often depicts a lack of consent as a desirable and acceptable one. But this is not okay. Porn does not usually show an accurate view of a healthy sexual relationship. It often cuts out the vital components such as consent, communication, and even foreplay. So definitely porn should be very much seriously taken into consideration, especially in the consent. And many times the youngsters take it for granted in the porn, as it is a very important aspect of the life. So it has to be changed in the in the view of the human relationship, and it is very importantly, it plays a very important vital role in the consent. So the real porn titles, if you want to see, there have been a lot of studies which says in the title, please know, there are so many millions of people are off views. And of course, the unwanted sex is around 2.6 million. And Tricure, that is a GFE, is only 13 million. So this is the real porn titles that they take when there is a interest in the porn titles, what they've conducted the study. So what messages do you think these titles send about the sex and consent? Nothing. So that is a very important one that you should keep in mind. So sex and sexual entitlement, there is of course the scientific research that shows that people internalize sexual scripts from the prawns. For example, when they see a sexual act, they believe that that is the proper sex. And because of that, they have a lot of pressure, and that makes them go for, if you look into the data, men viewing a porn, getting into erectile dysfunction because he believes that that is a real sex, and get into a trouble of properly doing sex, and he gets into a erectile dysfunction. He goes for anxiety performance, and he goes for all the complications of the pornography. So individuals even feel pressurized to imitate the pornography into their own sexual life, and that makes the pornography consumption as a predictor of feeling entitled sex. They feel that way, but which is not a good way to approach the consent conversations, which is very importantly seen in the pornography. About the sex text, that is a very much in, nowadays we see a lot of sex text which has been in the adolescence, and also all the persons, even elderly, older women, everybody has this sex which is becoming a very much common routine in many of the lives. But without a consent, this is also a very much a wrong thing to do without a proper consent. So anything related to the sex, either it could be image-based sexual abuse, sometimes referred to as a revenge porn, is a non-consensual sharing of the private or the sexual images of your past friends or your partners, or about the sexual abuse. Everything has to be condemned, and this is a form of a sexual abuse, and it has been happening more and more often in any recent years. We all know how it is happening, how they are blackmailing, and how they are doing all these cyber crimes. Everything is coming because of this sex, that is the sharing their private images and sexual images to the partners without a proper consent. So you should share any images with a proper consent. That is very important. So everyone must consent before anyone sends an explicit video or a picture. Remember, even after someone has sent you a picture, it is still theirs. So you can't forward or post it without their permission. So that is a very important one. The consent should be done. And image-based sexual abuse is illegal, and it can be even a criminal offense. It has been considered by the cyber rights and law, it is considered as a criminal offense. So when you are forwarding any abusive image or a text, you should get the permission from the person whom you have received that message. Without their consent, you are not supposed to forward to anyone. That's very important. And about the consent and the alcohol, definitely alcohol makes consent more complicated. So any consent given in an inebriated stage will not taken be as a consent. So no one can, when they're intoxicated, cannot give a consent, and any consent taken at that time will not be validated, or it is not certainly it will not be a proper consent. So about the STI, yes, whenever they say about the sex, when with a partner, you must be very honest about the STI, and definitely the protection for the STI has to be insisted. Even in the sex workers, it should be done without a consent. It should not be done. That is a very important point that you should look into it. So I think Kiran will talk about a few interesting cases. Over to you, Kiran.
Yeah, I think Dr. Jairani has put up 4 very nice scenarios. So actually this helps, I think, this part when we are talking to young adults to tell which is the red light or green light to indicate consent and which does not depict consent. So to put it a red light or a green light. So first scenario is Sarah and Shonda are there, who have been dating for 4 years. They have been having a relationship, but then Shonda's sex drive has decreased greatly and is sick of not having her sexual needs met. So she says, I'll have to find someone who cares about me and who wants to have sex about me. Now Shonda is afraid, so she has sex whenever Sarah asks. So this is one situation. And second scenario is they're just Dawn and Sue are at library, and suddenly Dawn begins to rub the Sue's neck and says, I am tired of working. And then Dawn pulls Sue in for a kiss, taking it as a consent. Then next slide. Then scenario 3 is Mark and Zelen, who meet for pizza and beer, and then after playing pool, and Mark ends up inviting Zelen back to his place. Here very clearly there is verbal communication to touch and kiss, and then they have Zelen kisses back and asks Mark to very clearly asking, to take his clothes off. Then scenario 4, Jill and Patrick are on their 4th date. And Jill is pretty sure that tonight is going to be their first time having sex. And after sharing a bottle of wine and making out on the couch, Jill starts to unzip Patrick's pants. So Patrick immediately freezes and stops kissing back. His body is rigid. See here, even the gender, it's not always woman who is at the victim or the victim mode or the receiving end. His body is rigid. So Jill asks if he's okay. Patrick replies, I am okay, I'm fine. But his voice is quiet and timid. So we can put up these scenarios and to understand the consent more clearly. So obviously in scenario 1, though Shonda is offering and agreeing to sex, it is not enthusiastic consent. It is due to coercion. So it is a red light. And second, there is neither communication, no permission and no consent, obviously very clearly. So it is again red light. Scenario 3 is a consented sexual relationship where verbally as well as bodily cues are there. Very clearly verbal communication is there and they're communicating and checking in with one another. That is the green light. And scenario 4 is here again. There are non-verbal signs from Patrick, though he says I'm fine. He's not comfortable with what is happening. So Jill has to stop and check in and not understand that this is a proper consent. So next slide. I think over to you, Dr. Jairani.
So that is what we all saw, the examples of what is the real consent and what is the consent which should not be taken. And these are all very important.
Actually, these 4 are very good examples of very clear consent, non-enthusiastic consent, coerced consent, and no consent.
Yeah. So that is a very important one that you should keep into it. And how to ask for consent is very important. The World Association of Sexual Health, they given norms that we have to ask like this. Can I help you out of that? It should be asked in a simple way. I want to kiss you, so that it's bad or right, or can I do it now, or can I? You should ask a permission like this. And it should be even sometimes funny and sexy. Sometimes if you feel awkward to ask into the straight with, sometimes they may not feel that mood may go off. They may have a lot of ways among the couples. They may have a lot of ways of some clues which they can use in their sexual life, which will definitely make them more funny and sexy, but that should be properly maintained among the couples. So that is also very important. So they can even have something like it turns me on when you're, all those type of a talk they can make, which will make them much more comfortable. Do you like it when I do this? Or you want to try like this? All these things can be made, but you can make your own words in that. That is why it is given as a it's marked as ditto. You can use among the couple, among the partners, you can use some words for yourself, among yourself, which you can make as a note, make it sexy and funny, that can make them little comfortable when you do it. So definitely you have to ask the consent. Without ruining the mood, you can make something into that dash, you can make it up, which is very comfortable among the partners. So this is what they tell how to get the consent during the sexual act. So consent, till now we have learned a lot about consent, how to take the consent, what are the types of consent, and how it is in the practical life, and how we have to look into the seriousness of the consent in the sexual activity, which always says very interestingly that your body is in your hand. You have to rule it, and nobody can take it without your consent. So make this consent as your guide in your life, so that you can be happy about your own self and your own body. So on this World Sexual Health Day, I thank you one and all for joining with us in this international webinar. And I look forward to all of you to join with us all through this year. We will be bringing out some important, I have a plan to make this for the adolescents to take this part, because many a times the sexual encounters, especially in the growing days of women taking into pubs, culture, smoking, drinking, alcoholism, everything now becoming very common among our social setup. We have a responsibility to make this adolescents to be aware of the consent about their body, about their sexual act, about their attitude towards sex, to be properly channelized and properly informed. And that will help them to give their life approach to the sexual act in a proper way with a proper consent. And that will avoid a sexual abuse and sexual violence also in that way. So with this word, I thank you one and all for your patient listening. And thank you, Kiran, for joining with me and giving this nice thought of yours. Thank you so much, Kiran.
I should thank you for making me part of this wonderful webinar. I learned a lot. Thank you so much.
But I think both of you have done wonderful job.
Thank you, ma'am.
We have learned a lot from the presentation, how to talk to the youngsters.
Yes,
Because,
actually, I was realizing we have to be more direct and more very clear in, we need not beat around the bush.
Correct. So we get little perturbed.
Nowadays,
to talk
children,
about it.
nowadays the adolescent
They
children want
understand.
something to
They
be open and
everything.
clear
They want us to be honest and upright. I mean, when we are communicating, that helps.
So tomorrow I'm going to use all these things.
Yeah, tomorrow we are going to have a session at the Yashoda, Dr. Jairani madam. So me and Jamna madam, Shanta madam also will be there.
Nursing staff and HR staff.
Thank you so much, Jairani ma'am and a vibrant president and Dr. Kiran. It was a wonderful, this one. It opened a lot of avenues for us, how to counsel a newly married couple or living in couple. Those people, when they come, like we are at a loss of words, what to tell. Okay, so because they express in different ways that they are not liking this kind of approach from their partner. We are not able to reciprocate because we are not equipped. I think this kind of webinars will make us much more equipped, so that we can also counsel them, because it has become a very sensitive issue, and you cannot brush it aside. Like you cannot say like, okay, it's quite common and all that. You have to be sensitive about this, and you'll have to be with them when they are anxious about a particular thing. You cannot say, nowadays we are getting many living in relationships. Those people are, married people, they are in a different plane. But when this living relationship, consciously the girl is consenting for everything. And at times she may not agree for certain things. And she comes to us thinking that we'll give her some kind of ideas. But I like both the movies. Actually, I had watched part of those movies, one by Amitabh and the other in Tamil by, I think it's Ajit. And there the main theme was this consent. Consent was a theme for both the movies made in India and in Tamil. No means no. That the lawyer will argue and he'll win the case only based on the single line. I said no means no. So that I think, I don't know how many people took it across. Still we are saying a lot of cases where they have been sexually abused and all that. It will take a long time, but we have taken the first step in the right direction. And without this kind of webinars, I don't think we would be more, we had been more made aware about this consent and all that. Thank you, Jairani madam, for organizing this wonderful webinar for us. And I thank on behalf of Chennai Menopause Society, as well as Shanti madam has asked me to extend our gratitude for including the society as part of this webinar. Thank you so much, ma'am. Thank you, Jamna Devi madam.
Thank you,
ma'am.
madam. Thank
Thank
you
you so much. It was
for being with us. And thank you, Hepzibah madam. Thank you, Shanti madam. Thank you, Dana madam, for being with us. And it gives me a great honor to have you all, the senior faculties, to be with us, to support us. And thank you so much, Krishna, for
Thank you, madam. I'm so sorry for being late because this thing said it was 6:30. I got a little delayed. I'm so sorry for that. Thank you so much to all our panelists, chairpersons, Hepzibah madam, all our senior members. Chitrakala, thanks a lot again for doing this. Kalaivani madam, is she online to deliver the vote of thanks?
No, please, you go ahead, Krishna.
Thank you. Thank you so much. I can't thank all our viewers and Dr. Kundavi, a special sorry to you because I kind of missed this thing because I was a little hesitant. Shanti Madam, Revati Madam, Dhanalakshmi Madam, Jamuna Madam, Kiran Mai, thank you so much. Jayarani Madam, thank you again so much for giving me this opportunity. I would like to share one small thing which recently happened. I was put for a boys in a college. They were all 18, 19, 21 years. So, you know, I think for the first time, I think so many boys did ask me questions. So, you know, and they had a lot of input. Madam, even after I think all their question was, one boy asked, if I don't like girls, they actually forced me to do it. I think when Madam put this scenario, I think we are seeing this so much more. So yes, thank you so much for these kind of webinars, and thank you one and all for coming for this wonderful evening. I know it's a Sunday. Thank you so much. Good night.
Thank you.
Worth a Sunday.
Thank you.
We should have a recording of this. I think someone is
think so.
and Dr. Vijay.
I'll share the link.
I think even
Let's
I would
share
love
the
to.
link tomorrow so that I'll put in the group for all of us, right?
Yes,
Thank
wonderful.
you so much.
And also, Vijay sir's PowerPoint,
yes.
madam, is very important.
Yes, that is very important.
Yes. Thank you so much, ma'am. Good night.
Good night. Good night, ma'am. Thank you so
Bye,
much.
Kiran. Bye.
Bye, ma'am.